All right, first and foremost, I want to give all praises, honor, and great glory to Yahweh, Ba'ashem, Yahweh Shai, Ba'ashem, Rakha, Kwadash. Double honors to the apostles and elders of great millstone that rule well, and salutations to the elect pushing this truth to the four corners of the earth in truth and in sincerity. Before we hop into this video, I want to say Salakia. I am on a plantation in a cafeteria. It's pretty empty in here, so I can get the video off, but Salakia for the noise in the background. The TV is all on in here, so Salakia for that. But anyway, in this particular video, I want to touch on the bird flu again, because in the previous video that I made, I was saying that, what they're saying about the bird flu is similar to the Crown Vic Royale, how it did not affect people. It's no public health risk as of right now. They're saying certain things like this, but the Crown Vic Royale started mutating time after time after time after time, became way more deadlier than the first strand, right? According to Esau. Now, the bird flu is going to do that same thing. It's doing the same thing. And in the previous video that I made, I was touching on that, saying, well, they say it's no public health risk right now, but don't be surprised if they come out with news saying that it's mutating. And in this video that I'm about to play, that's exactly what they're saying. They're saying that it's finding a way to make people more sicker when it's in people, and it's mutating. All right? So there's concerns about it mutating. And it's not person to person. You can't contact it through another person, because people can't spread it to people, but you can get it from contacting with an animal that has it. So they're saying this has the potential to be the next pandemic, and to keep your eye out on it. But 67 people in the United States have it already. One already died in Louisiana, and they're saying it's finding a way to mutate already. So if this becomes person to person, it could be contracted person to person, then you're looking at a potential next pandemic. So this is prophecy jumping off of the page once again, Matthew 24:7, when it talks about pestilences. All right, as a matter of fact, let's get it just real quick. Matthew 24:7, and we read, "For nation shall rise against nation, and kingdom against kingdom, and there shall be famines and pestilences." You see that? That's more than one. Crown Vic Royale, airborne Ebola, which is the hemorrhagic fever, EEE, West Nile virus, bird flu, monkeypox, so forth and so on. And things that you ain't never heard about can come down the pipeline. But hey, we're focusing on that bird flu right now. And since an earthquakes in diverse places, right? This prophecy jumping off of the page. You see? The bird flu virus is evolving. NBC News medical analyst shares what you need to know. Once again, in the beginning of Crown Vic Royale, they said it did not have an effect on people, was not a threat to people. But then they said it could only affect the elderly and those with underlying ailments already. Then it mutated, and then now the elderly wasn't just the elderly, it was normal adults to young adults to teenagers to children, and children on even down. Now they said the animals can even get it. This is what they're saying with this virus as well. They're saying animals outside can get it, not just birds. But I heard aquatic life can get it, cows can get it, your cat. And you see, and if you can contract it from animals, then it can go to you. If you have an inside cat, you let the cat outside to go, mess around or whatever, and it comes back inside. You can get it that way. And then if it evolves from person to person, that you can contact it from other people, then hey, there you go. They can declare a national emergency and declare a pandemic. And this is neither here nor there. It's just something to keep your eye on. With that, I'm gonna play this video.
Well, tonight the CDC is issuing a warning about the rising number of respiratory illnesses. Cases of seasonal influenza, COVID-19, and RSV are all up across the U.S. tonight. At the same time, the agency is tracking the risk of bird flu in both animals and in humans. Joining us now live is Dr. Ben Gupta, leading pulmonologist and NBC News medical analyst. Doctor, thanks for joining us tonight.
Joyce, it was good to be with you.
Okay, so first, tell us what's happening with bird flu and the limited information that we are getting through the federal government.
Well, that latter point first, we're not really getting anything at this point, and there is that pause in communications, which worry us at the bedside. Patients across the country, whether they're in Seattle or anywhere across our nation, rely on information that's not partisan and from these agencies. Even just data, simple data, Joyce, on what's happening with these respiratory viruses. The last report out was actually January 17th. So this is worrisome. We're flying blind on where we are with bird flu. At least the data that we have at the state level suggests that this virus continues to evolve. We saw that in the case of a young teenager in British Columbia, that the virus does seem to be finding a way to change once it's actually inside a human being, that it's figuring out ways to make patients sicker. It's mutating in real time, and that's the concern. We haven't seen
mutating in real time. Don't be surprised if they said, if news come out saying that the first case of human-to-human contact is out there. Hey, don't be surprised.
A sustained human, or we haven't seen really any evidence of human-to-human transmission, which is critical because we know that flu, if there's going to be a pandemic, flu can be a big driver of that. But in the absence of any evidence of human-to-human transmission, bird flu remains a concern. That's something that we should be vigilant on. You're seeing very proactive approaches in places like California, but it's not a significant concern to the general public.
There was a person with a severe case of bird flu in Louisiana, who I'm sure you're aware of, died earlier this month. Some started asking whether or not it could be sort of the culprit of a next pandemic. It sounds like that's not a valid concern, but people are starting to ask questions about that. What is your comment on that?
Here towards the end of January 2025, I'd say as we are right now, the worry about a near-term pandemic is lower. However, the fact that bird flu went from birds to cattle to now just in our state, Joyce, right before the holidays, we saw 20 big cats die. I mean, that is scary, very disconcerting headlines. And that's something that should keep us all very, very vigilant, because this is something that's impacting all types of mammals. It's not going to be far from posing a potential risk to us as humans when it comes to human-to-human transmission. So I think this idea that we need to prepare actively.
He said, so when it becomes a human-to-human transmission. Let me just bring that back.
All very, very vigilant, because this is something that's impacting all types of mammals. It's not going to be far from posing a potential risk to us as humans when it comes to human-to-human transmission. So I think this idea that we...
You see? See, it's not out, it's not too far-fetched that this virus can mutate. It can now spread from human to human. Keep your eye on this now. And don't forget the powers that they had with Crown Vic Royale. You're talking about curfews. You're talking about you had to get jabbed or you won't have a job. They wanted to roll out contact tracing, which contact tracing is everybody has an app, was forced to download an app on their phone, and they track you in real time. And if you bump into anybody that actually tested positive of the virus, then they will call you and tell you came in contact with this person and you need to quarantine. And I believe they'll contact your employer and tell them as well. Then don't forget you have Bill Gates, that he wants to actually make a team called GERM, Global Epidemic Response and Mobilize, which is actual team to come out there with hazmat suits and quarantine certain places, man. Hey, come on. Don't forget the powers that they had with Crown Vic Royale. All right? And they also was calling for people who didn't take the poke to be jailed They said they were spreading misinformation. They wanted them jailed. Some of them were calling even to put people who didn't want to take the Pope to be put to death. All right? Keep your eye on this, man. Let's not forget what happened with Crown Vic Royale, because we can see very similar things happening with this bird flu. So just keep your eye on it.
We need to prepare actively new therapeutics, vaccines in the pipeline, more testing, especially of cattle, of other livestock like poultry. Again, as you're seeing in places like California, active testing to understand the extent of this, that's critical. But number two, the CDC, again, last week pointed out that there needs to be urgent evaluation of anybody that comes into any hospital across the country. If they test positive for flu A, to do the next level PCR testing to understand, is that actually bird flu? Because Joyce, to your point, because we're not really doing that advanced testing, even though the CDC has recommended it for about a year, it's hard to understand the true dissemination of this virus across the country.
Will vaccines against the flu or COVID-19?
All right. Hope it was edifying. Hope you can take something from it. I got to get back on the plantation. So with that, I'm going to say shalom.